On 15th May, the Ministry of Health in the Democratic Republic of Congo confirmed an outbreak of Ebola disease in Ituri province in northeastern DR Congo. According to the Africa Center for Disease Control in the Democratic Republic of Congo, a total of 575 suspected cases was found, 51 confirmed cases, and 148 suspected deaths. The Ministry of Health says that one case was reported in Uganda following a Congolese national who was infected and later died at Chibuli Hospital. Following news from various international news outlets, Uganda has been portrayed as one with a situation close to that in the Democratic Republic of Congo, yet only one person has died and about 120 in quarantine. Ministry of Health officials have updated ambassadors from various countries on how they are managing the disease.
In Uganda, as I talk, the patient we had in our isolation tested negative. We have not registered any other positive in the country. All high-risk patients, all high-risk health workers that have been in our isolation center for the last 1 week, nobody has tested. Even when they were exposed right from 10th, nobody, today is 22nd, nobody has tested positive. All our people in our centers, we keep on checking, no one has tested positive.
Uganda has had about 9 Ebola cases. Dr. Jean Kaseya, the director at the Africa Center for Disease Control, called on African representatives to work together and find a vaccine that could put an end to Ebola.
We know this outbreak for more than 17 years, or 19 years, Butibungyo. Why do we don't have vaccine? Why we don't have medicine? Are we sure if we had this outbreak in Western countries, after 19 years we'll not have vaccine and medicine? This is why we decided to accelerate the process, and the meeting I will have today, they will brief me on what took place yesterday and additional effort. We need by the end of this year to say that for Butibungyo, we have vaccine, we have medicine. There is no choice.
In the bid to fight Ebola across all borders, President Museveni organized a team that will be at the forefront of fighting Ebola. Experts in the team say that about 90 billion shillings is needed to fight the spread of Ebola for about 3 months. Dr. Diana Twine, the permanent secretary of the Health Ministry, says that the money is not enough compared to the task.
I believe even these media people, you know, they like blowing things out of proportion. They will say, oh my God, this is 90 billion. You know, they have no idea that 90 billion for Ebola response is just a drop in an ocean. Because even right now as I talk, we have spent, I think, over $1 billion. Just the teams at the border, crisscrossing all those districts, picking samples from Arua, from Chisoro, from day and night. They have no idea. They just have no idea. But we want to continue ensuring that we have value for the resources that you have pledged and you have given.
She said that Uganda is ready to help her neighbors in fighting the disease.
We encourage regional approach. This Ebola poses a unique experience in our response. And we are calling upon partners that even when you are supporting regional efforts, we need to know who is doing, because Uganda is available, first of all, to support DRC. We are open. We really want to support DRC.
NTV has learned that tomorrow, the health ministry officials in Uganda, South Sudan and the DR Congo will meet to devise better methods of collaboration. Maria Jacinta Kanyange, NTV.